Childbirth is one of the most remarkable transformations the human body can experience, and it begins long before you ever meet your baby. During a vaginal birth, labor unfolds in 3 continuous stages, each one guiding your body closer to delivery. The process often starts when your baby settles deeper into your pelvis, signaling that it's time for labor to begin. In response, your cervix begins to efface, becoming thinner, and dilate, slowly widening to prepare for birth. You may feel strong, regular contractions occurring every 5 to 20 minutes, along with persistent lower back pain and cramping that doesn't go away. As labor progresses, you might notice a brownish or reddish mucus discharge, known as the mucus plug, which signals that the cervix is opening. Your water may break at this point, either as a sudden gush of fluid or a slow, steady trickle. If any of these signs appear, contacting your doctor or midwife can help determine when it's time to go to the hospital. As labor advances, your cervix eventually opens fully to 10 centimeters, and your baby's head moves into the birth canal. This marks the beginning of the pushing phase, which can last anywhere from a few minutes to several hours. You may feel an intense, instinctive urge to push, or you may be guided by your doctor, midwife, or labor nurse on when to push and when to rest. During a typical delivery, your baby's head rotates to face your back while your uterus works in 2 coordinated sections. The upper portion contracts powerfully to push the baby downward, while the lower portion remains flexible, stretching to create space for the baby to pass through. As the top of your baby's head becomes visible in a moment called crowning, a small incision known as an episiotomy may be performed if needed to widen the vaginal opening. With continued pushing, your baby's head moves through the birth canal and may temporarily take on an elongated shape, a normal process that usually resolves within a few days as the skull bones shift back into place. Once the head is delivered, it gently rotates along with the shoulders, allowing them to pass through the pelvis one at a time, and after the shoulders emerge, the rest of the baby slides out smoothly. Moments after birth,